Dr. Mary Jane Doyle.
Yes.
Great. And here we are in Hammond, Indiana?
We're in Highland, Indiana.
Highland, Indiana. Okay. And we're in your office here, in your clinic. And how long have you been in practice?
I've been practicing as a chiropractor since 1982.
Okay. So you are very experienced.
Yes, I am. I've been doing chiropractic since then. I enjoy it, and I love coming to work every day, and I have a good time at what I do.
Well, that's great. What I'm interested in is comparing you to other chiropractors and what distinguishes you, well, and even other medical doctors. And I'm interested in all these years. I mean, you must have seen thousands of different people. You've probably cared for thousands of people.
I've cared for all sorts of people, and one of the things that I do differently than other chiropractors do is I use a technique called sacro-occipital technique.
Now, did you always use this technique?
I have used other techniques, but this has been my primary technique, which I have always evolved towards because I enjoy it so much.
So
in
the first 5 or 10 years of practicing, you weren't really focusing on this.
That's correct.
But because you've seen this technique work more and more and more with patients,
yes,
you've integrated this technique into your...
yes.
Okay.
And one of the reasons I did is because as I was treating people, I wanted to have a technique that was very effective and would work faster and was a more advanced technique than what I was traditionally using.
Mm-hmm.
So I started using this technique on people that I was having, that were considered difficult cases where they have a lot of problems and it takes them more to get well because they have more issues and their tissues are in worse shape, and they might have dietary problems and many chronic problems. So I started using more soft tissue work through SOT, which also,
SOT?
Yes, it's called sacro-occipital technique,
Mm-hmm.
SOT. And we use some basic cranial maneuvers with it. Some people call it cranial sacral, but it's really chiropractic craniopathy. And we use cranial sacral with it, or chiropractic craniopathy, as well as very, very gentle maneuvers to work the reflexes around the spine, around the muscles, and around the joints. And we also use these things called blocks or wedges that we put underneath the pelvis to reposition the pelvis to stimulate a pump that's in your lower back.
Well, what kind of, that's a little technical, but I appreciate it. I'm wondering what kind of conditions have you found effective, that you've been able to help?
Well, we've treated things such as fibromyalgia,
Right.
TMJ problems with the joint in the jaw,
Mm-hmm.
digestive problems, irritable bowel problems.
You've had some successes with these.
Yes. Allergies, asthma, a lot of sinus conditions respond very well to craniopathy, and actually pretty rapidly. Ear problems with children, earaches.
Oh, okay.
Some learning issues as well, kids with learning disability.
So let me see if I understand this. So over the years, there's basic chiropractic technique, but over the years, you've searched out and found maybe more sophisticated or more scientific techniques that you've integrated into your style.
Yes.
Which include SOT, which stands for, again,
sacro-occipital technique.
Okay. And some cranial...
Sacral maneuvers.
Sacral maneuvers.
Chiropractic craniopathy.
Okay. And you sometimes, in addition to adjustments or manipulation.
Yes. Well, it's all part of the adjustment.
Okay. And you include sometimes some, I guess you've mentioned once, trigger point.
Yes. Well, trigger point is that's actually a massage technique where you find the area that's the spasm and you release it by pressing along the belly of the muscle.
So you have a whole protocol that you do that includes many techniques, and you do this for each patient. So it's really customized for each patient. Okay.
And you know what? Adjusting a patient is not like doing the same thing over and over. When someone comes in, it's like reading a map. Okay? Today we're going to go from Chicago to St. Louis. Okay? The next time we're going to go from St. Louis to Kansas City. Okay? We're not going to go from Chicago to St. Louis every time we see you. We're not going to use the same technique, or I'm sorry, we're not going to adjust the same segments and do the same thing every time you come in, because we have to read your spine like a map. It has certain indicators that tell us where we need to go and what we need to do.
Mm-hmm.
And so that's what we do every time you come in. We check and see where we need to go today, what do we need to adjust today, what is your body telling me? When I test your muscle, is it weak, is it strong?
Mm-hmm.
What are the reflexes in your upper back telling me? What are the reflexes in your head telling me? What does your cranial pulse feel like today?
Fantastic.
And so we do all those things every time you come in.
Well, we're going to end off here so we can keep this video short, and we'll do another one later. Give us an example of somebody that who came in that might have not responded well to medical doctors, of course, drugs or surgery, that you were able to, with this technique that you've put together, responded well and had some good success with.
Well, I can think of a child in particular with ear infection, very bad ear infection. And he had been the medical route and had antibiotics and used to wake up about 11 a.m. at night just screaming. If you've ever had a child with an ear infection, you know they have to scream at 11 o'clock at night and just would hold his ear would be red, and would have to sleep with the parent because he didn't want to be left alone, and just, you know, very uncomfortable and very scared because his ear was hurting so much. So I just adjusted him and did a very gentle called temporal rocker technique on his ear, and he went to sleep, and I guess the next morning there was actually drainage on the pillow where the ear had drained, and the fluid that was creating all the inflammation had drained out of his ear, and he was doing very well.
Wow. Well, I had a chance to spend the time with your staff today, and I saw a lot of happy patients. So keep up the good work, obviously, and we'll videotape you again.
Well, thank you.
Okay.